Thank you for coming and thank you for viewing online. How we sound on audio? Everything sound good?
Got about a 10-second delay here.
Okay, video is good. All right, we'll start in a few minutes. Thank you. Oh, actually, I guess we'll go.
Yeah.
Yeah. Okay. Well, thank you everybody for being here today. The purpose for having this press conference is that the Department of Health and Human Services has received several inquiries from Nebraska families, providers, and the media regarding planned rate adjustments regarding the service of applied behavioral analysis, otherwise known as ABA. I'd like to introduce the people standing with me today. To my immediate right is Drew Goncharowski, the director of the Division of Medicaid and Long-Term Care for the state of Nebraska. And to Drew's right, or Director Goncharowski's right, is Dr. Corsi from Monroe Meyer Institute over at UNMC. ABA is a vital service that Nebraska children and families rely on, which can be beneficial for children with autism spectrum disorder and other developmental disorders to help them improve social interactions, learn new skills, and increase positive behaviors, and in many cases, increase independence. DHHS fully understands the importance of Nebraska kids and families, and we also fully understand that this is an important service, and we are unequivocally committed to ensure that Nebraska families have appropriate and needed access to necessary services. DHHS has had continuous meetings with stakeholders, one of which has been MMI, regarding our efforts to adjust payment rates to sustainable levels. Unfortunately, during these meetings, we've also, not with MMI, but we have also identified, in some cases, inaccurate information, some of which has come from national corporations regarding our efforts to adjust payment rates. This meeting today is to set the record straight by providing truth, facts, and data. As you can see by the graphs, and these graphs really do speak for themselves, there are 3 up here. Nebraska payment rates, this is Nebraska here, and this is Nebraska here. Nebraska payment rates for ABA services are currently the highest in the nation across all 50 states. Per federal regulations, payment rates must be established in a way that promotes efficiency, economy, and high quality care. We want to ensure that happens, and we're committed to that. With that, I want to introduce Director Goncharowski to take the podium and share his thoughts, and then we'll work our way across. Drew?
Yeah, thank you, Steve, and thank you for everyone for making the trip today, and for everyone out there listening also, thank you for tuning in. So first, let me give a brief history of what actions DHHS has taken to sustain ABA services in the state of Nebraska. In our several meetings, our stakeholders made us aware that some national corporate providers were spreading inaccurate information regarding ABA payment rates. Beginning in 2022, there were multiple provider discussions as a provider type did not exist in Nebraska for ABA. In September 2022, DHHS reviewed providers without certifications and identified billing issues and re-educated those providers. In March 2023, DHHS distributed a provider bulletin advertising telehealth was no longer allowed as of July 1st, 2023. In August of 2023, a legislative bill was passed to create a provider license for ABA services. This was LB 123. In 2024, limits to telehealth and medical necessity definitions were implemented to align with other states. And finally, DHHS recently completed a thorough review of Nebraska Medicaid rates for ABA services and observed that Nebraska's rates are significantly higher than all 49 other states. In fact, ABA rates in Nebraska for some codes are more than double the national average. This analysis is supported through publicly available information such as available from organizations such as the Council of Autism Service Providers 50-state Applied Behavioral Analysis Medicaid benefit comparison. In 2020, just looking at the bottom graph here, Nebraska Medicaid paid $4.6 million for ABA services. Comparatively, in 2024, Nebraska Medicaid paid $85 million for ABA services. This amounts to an increase of more than 2,000%. And just with a little bit of that background, I'll turn it back over to Steve for a little more further discussion, so thank you.
Thank you, Drew. Yeah. So in fact, Director Goncharowski said that was slightly over 2,000%. As I recall, and I did these calculations repeatedly, I believe it's exactly 2025, give or take a little bit of room. That's just an incredible percentage. So in order to ensure that these services are available and sustainable, it's vitally important that we adjust those payment rates and align with surrounding states. Before rate adjustments, Nebraska's rates were significantly higher, as you've already heard, leaving Nebraska as a pronounced statistical outlier. Nebraska Medicaid rates for these services will remain competitive with surrounding states, and they will remain above national averages. We're proud of that. Per Title 42 CFR 447.200, payment rates must be established in a way that promotes efficiency, economy, and high quality of care. As a result, we're aligning the ABA service code rates with rates paid by other states for these same services to comply with federal rates. We're committed to working with our members. We want to be exceedingly clear. DHHS is fully committed to continuing ABA service to Nebraska families receiving Medicaid and will continue to operate in the best interests of children and families. At this time, I want to introduce Dr. Corsi from the Monroe-Meyer Institute. MMI is one of the premier providers of services. They are our state-run medical experts and facilities. as well as academic institutions, and we're grateful that you're here, Doctor. Come on up.
Thank you, Steve. So let me start that certainly these data are very not only interesting but compelling and thought-provoking. So my name is Karoli Mernix. I have the pleasure and the privilege to serve for the last 10 years as the Dean and Director of Monroe Meyer Institute at UNMC. So for those of you who don't know who we are one of the biggest and oldest intellectual and developmental disability diagnostic and treatment centers in the whole world. We are about 105 years old, and we are the biggest provider of services in our state. We have approximately 120,000 clinical visits, and out of those, about 60% of individuals we serve have a diagnosis of autism spectrum disorders. Needless to say, as we are the top ABA PhD program in the nation, we are committed to provide evidence-based, accessible services and best services to our population. So, and here I will pivot a little bit. So for the last 10 years, we have developed an amazing relationship with DHHS and the state. We are partners, and we had many, many wins together, from the waiver to the COVID vaccine to everything else, and we learned to work together. We might not always see exactly the same way everything, but we arrive to good solutions. So I would dare to say that we are probably the model partnership between an academic institution and the Department of Health and Human Services in the whole nation. You know?
We would agree
So-
with that, Doctor.
And so what we will do, we will continue working with DHHS as very close partners and develop an evidence-based guide rails to provide the most meaningful, most efficient services for all individuals with ASD. And let me be clear on this one. This will be done very thoughtfully, collaboratively, and based on scientific data. Because that is what is expected of us, both of us, and we have to be safeguarding our resources. So the state didn't, and DHHS didn't choose to do it alone. They chose to come to us as experts and to hear our opinions and the evidence, and we greatly appreciate that because I think that's the way it should be done. So with that, thank you, Steve,
Yes, sir.
and looking forward to work with
Thank
both
you.
of
Can I
Oh, yeah, I'm giving you back
Thank you.
yours.
I had a couple of
I
notes.
have
No, you're good. I had a couple of notes back here that. So before we move to questions, we want to address a few additional issues around the sustainability of care and reiterate a few points. Due to the history of rates that, as we've discussed, and among other clinical and operational factors, we have seen a significant increase in providers come from outside of the state. The hours being billed by providers is well above the standards what we see with other providers, such as MMI. In fact, I'm just going to comment on that briefly. MMI, fairly standard practice, I think that's a reasonable way to say that, is that MMI may bill for a youth or a child with ASD in the 7 to 15 hour per week category. In many cases outside of MMI, we are seeing in excess of 30 hours a week, or in some cases, even in excess of 40 hours per week being billed. We have to ensure that our policies and our reimbursement rates reinforce and align with the best standards of care. And we want to ensure that our standards do not deteriorate and that we're only providing care, such as MMI, at the highest levels of quality. We want to ensure absolutely that we don't have poor standards of care happening across the state, and are committed to offering the best quality to Nebraska families. With that, we would love to open it up to any questions. I think the graphs fairly tell their own story, but we're happy to take questions if there are any. Yes, sir.
So what actually is the rate adjustment? What is the change? What is it now versus what we'll see going forward?
Drew, do you want to address
Yeah,
the
I can-
specific rate?
I can talk-
That'd be
I can talk
fantastic.
through it.
Yeah.
So the targeted rate changes is across an array of service codes, and I can just walk through them. Yeah, because I think that I can go through the majority of them, and just I'll speak to what the new rates are across the service codes. So for the applied behavioral analysis behavior identification assessment, the new rate effective 8/1/2025 is 38.16. It was previously 54.17. The second rate on this, supporting assessments for applied behavior analysis, behavior identification assessment administered by technician. This is effectively a supervision code. Under supervision by a physician or other healthcare professional is 2588. It was previously 3611. The adaptive behavioral treatment by protocol administered by technician. This is, and these are all 15-minute codes, just for the record. This is 97153. This rate is the new rate effective 8/1/25 is $18.70, previously 3611. Some of these other codes, group codes, are being updated to reflect that it was a group code. It was previously billed at the same rate as the individual code, so it's moving to 749, and it was previously 3611 as it was with the one-on-one code. There's the next code, which is the treatment administered by physician or other healthcare professional, is moving to 2272, and it was previously 3611. The next two codes, so family adaptive behavioral treatment by protocol administered by physician or other healthcare professional, with or without patient present with guardian or caregiver, is moving to 2606, and it was previously 5417. And the final code is another group code, which is administered by physician or other qualified health professional with multiple patients, is moving to 1205 to reflect that it's a group code when it was previously a single code at 5417. And I'll highlight in here that this figure was pulled from this CAS national study. This is the 97153 code, and you can see that our 3611 is obviously a statistical outlier on this code, and effectively you could look at this and say under our new rate change, we're correcting something that we were paying effectively $60 more an hour than the next highest state in the country for this rate.
I really appreciate you walking through that, but you can imagine TV viewers' eyes glazing over.
Yeah.
Walk through every single
Yeah, I
day.
hear that.
Is there a dollar figure that kind of contextualizing the whole scope of this that the state will be saving, I guess, on this particular thing when it comes to this rate adjustment?
We don't have an immediate estimate attached to that, because ultimately this was about making sure that we were getting this right with the service. We have an obligation to ensure that we are competitive with other states, and we're also just working to ensure that we do not create any unnecessary incentives or incentives with discrepancies on rates to our neighboring states. You know, we do not necessarily have a savings estimate attached to this yet.
Actually, I want to address that really quick too, Drew. Thanks. So, what was your name?
John.
John, thanks for the question. I want to be incredibly clear. We do know that the state is having some budget woes, and we're working through those as a state. These rate adjustments have nothing to do, absolutely nothing to do with those budget woes. Now, they may benefit us there. That's probably true. But even if we had an excess of $500 million or $5 billion, this is still the right thing to do. We would need to do this. In fact, as we adjust these rates, John, we have looked at all of the contiguous states around us, including some others. And we are still, we are not only in the average range of all the contiguous states around us, we're well above the national average overall across all 49 states. So this is just the right thing to do. You know, we have a responsibility as a department to be good stewards and trustees of taxpayer dollars. You can look at the graphs. We just don't have a choice.
So it doesn't have anything to do with the state budget laws. Can you contextualize it in the national perspective? Of course, there's just a major bill passed, the
Sure.
Capitol Hill, that will look at Medicaid cuts over the next several years. Is there anything, any resonance there, any connection there? Can you talk about this, any fears that there might have to be further adjustments down the line if these Medicaid cuts don't?
So I apologize, John. We're really not here to talk about the one big beautiful bill. We certainly are always engaged in the analysis as there have been adjustments in the reconciliation process between the House and the Senate. We're constantly internally looking at what that'll mean for us. I don't have those numbers for you today, but to my knowledge, well, I just don't have those numbers for you today. Our focus right now is on adjusting these ABA rates to get it right.
Right, and I
Yeah.
just wanna be clear, this is not like, just as it's not connected with the state budget laws, as you would say.
Oh,
it's
gosh.
not connected
Yeah,
with
not at all.
what's going on in DC. This was happening already. You guys have been planning this for a while.
As Drew talked us through kind of point by point, this really began to make itself known around 2020 or even 2022 and 23. And I first became aware of it probably in midsummer last year. I believe that's about the place, and was told, hey, we've got to get this fixed. So we've been working on this since even before the new White House administration. Yes, sir.
And Director Corsi, what's your message to families who, they've been looking at this for a while, worrying about a potential rate adjustment, concerned, sounding alarms
Sure.
on this, saying they rely on this and that this could be a crisis, a disaster for them? What is your message?
Thanks, John. I appreciate the question. Appreciate the opportunity to address people across the great state of Nebraska. The message is very simple. It's that we are going to protect, and this is an act of protecting resources so that families that need necessary care for their children, they get that care. That's the message. We're going to ensure that that's available well into the future. No other questions, Jeff? Any other questions, anybody? No? Okay. Thanks for being here. John, appreciate the questions. Thank you, gentlemen.